I'm Dr. Aaron Camp. I'm the Dental Director here at Kids Dental Brands. I wanted to talk a little bit today about our mentoring program and what that means to our newer doctors. We try to create an environment that is pushing our new doctors to learn. We're starting them out slow, we're getting them into the clinic, and we have senior doctors there with them at pretty much all times to answer questions, to give them advice, to help them enjoy this process of the first couple of years out of dental school. During this initial time with us, we try to follow what we call a one mentor program. What this is you'll get paired up with one of our senior doctors. They'll go everything from pre-employment all the way through hopefully ownership, and to make sure that you're getting off to a good start. When you're paired up with just one person, we find that the training is a little bit more consistent and that you learn more. You miss less procedures, and we can really help to tailor that program a little bit more consistently for you. Our mentorship program is broken up into 7 steps. That starts everywhere from pre-employment, where we'll chat with you on the phone before you even sign up with us. Generally what happens is our recruiter will reach out to me and say, hey, Dr. Camp, can you call this doctor here or that doctor there? And I'll give them a call, and I'm really in charge of answering all those questions that are clinical related. We're really trying to make sure that you have a good understanding of what our office is and what our philosophies are when we're seeing kids. We try and paint a pretty good picture of what's going to happen on that first day. We're trying to answer all the questions related to, hey, how do I schedule? What's my workflow like? How many patients am I seeing? What kind of procedures do you do? And those are really questions that need to be answered by one of the clinicians in the office. So someone like myself or one of my partners. Those kinds of questions, although it takes some time out of our days, we can really make sure that any of our newer doctors has a really good understanding of what they're walking into. We don't want any surprises there on the first day. The second step of our mentoring program is onboarding. There are a ton of questions. Luckily here at Kids Dental Brands, we have a phenomenal onboarding team. They help everything from your benefits to all the way through the credentialing. And believe me, if you ever have to do your own credentialing, you're going to be glad that they're here. Our mentor is there to answer those questions, to kind of reach out when we're missing things, and just to make sure that you have somebody that you can reach out to if you have questions during that process. The third step of our mentoring is an introduction to the office. So whenever possible, we're trying to get you into the office, show you, give you a great tour of the office, show you the workflow, show you our computer systems, and introduce you to all the important people that you need to know, everybody from the dental assistants all the way up to the front office manager. We try to actually make that first day that you're in there working so it's not quite as foreign to you. So you can get in there and you feel a little bit more comfortable about what the day is going to be like. The fourth part of our mentoring program is actual work. We start out with a very limited, kind of a partial schedule for all of our new doctors. We do that for a couple of reasons. Number one is the simple fact that a lot of times coming straight out of school, you're not quite ready for a full schedule of patients. We want to make sure that we're easing into that schedule so you can really spend the time on quality and not quantity. We also want to make sure that there's enough time that we can go over treatment planning, we can go over some cases between you and your mentor. We've actually found that by taking things a little bit slower at the beginning, it allows our new doctors to get all of their questions answered, and it really allows them to concentrate on quality. And by starting out slower at the beginning, we find that they get up to speed a lot quicker. These first few months of a new doctor's career are extremely important. Many doctors will practice their entire careers bouncing from job to job to job and never get a good chance to see their work come back. By starting out slow and working with your mentor, we're able to take a lot of post-operative radiographs and really critique that work. And we're not critiquing in order to nitpick. We're critiquing so we can become better doctors and we can provide a higher quality of care for our patients. Our fifth step of our mentoring program is right here in Scottsdale, Arizona. We wait for about a month or two after you've been in the office, just enough time to come up with some questions, and we'll bring you out to Scottsdale for a solid week to work with one of our board-certified pediatric dentists. They'll go over everything from treatment planning to crowns to space maintainers, and hopefully you'll bring a lot of good questions to ask during that time. This program allows a lot of one-on-one training with you, and it allows that feedback that you can get without actually sitting there in front of the patient. That allows you to ask those questions without having a mom look at you, and allows us to make sure that these questions are getting answered appropriately. Our sixth step of the mentoring program is ramping up to a full schedule. Usually around month 2 or 3, our doctors, their speed's getting up, quality of their dentistry is phenomenal, and so we're ramping up to a full schedule. Our full schedule generally entails 1 patient an hour for operative, and that might be a buccal pit or it might be 2 quadrants of dentistry. That kind of depends on the doctor. It also entails usually 3 to 4 recall or new patients an hour, and that's just exams. Those exams can take anywhere from 3 minutes for a parent that already kind of knows what's going on, all the way up to 15 or 20 minutes if a parent has a lot of questions. Our goal with this mentorship program is that you have all those answers to give that parent. And once again, I want to reiterate that by us taking those first couple months slower, our doctors are able to ramp up to that full schedule quite a bit quicker. The 7th step of our mentoring program is hopefully ownership and management. Over the course of your career, you're going to get much, much better at your dentistry, answer all those difficult questions that parents have. We're trying to mentor our doctors for a lifetime career with us. As soon as we've had a doctor master the dentistry and master those personal skills necessary to work with parents, we start talking about management. As management opportunities arise, we're looking out for our doctors that have that drive. Some doctors are very, very curious what it's like to manage an office. With the size of our company and the growth that we've been experiencing, management opportunities are coming up quite frequently. After management, our ultimate goal is ownership. We're hoping that all of our doctors choose to spend their career with us. And many doctors' ultimate goal in their careers is owning a practice. All of us here, except for our founder, Dr. Brad Roberts, started out as associates. I started out as an associate, and my other 30 partners started out as associates. Our ultimate goal is that one day you will become a partner as well. Hopefully you've enjoyed this video on the overview of what our mentorship program consists of. Over the next several videos, we'll be going a little bit more in depth over each step, and hopefully we can answer those questions that you might have.